Mr. Jackson, take you through.
Good afternoon, my lady. Could I check if you can see and hear me okay first?
I can, thank you.
My lady, the next witness is Daniel Singleton. May he be sworn, please?
Stand, please, and take your right hand. Repeat after me. I swear by Almighty God.
I swear by Almighty God.
That the evidence I shall give.
That the evidence I shall give.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
Thank you very much. Make yourself comfortable.
Now, you are Daniel Singleton, is that right?
Yes.
And Mr. Singleton, you've provided a witness statement to Module 10 of the inquiry. The reference number INQ 000657972. And Mr. Singleton, this statement is produced in your capacity as the National Executive Director of Faith Action.
That's correct.
And that's a post that you've been in since 2007.
Yes.
Faith Action itself is a national network of faith-based organisations seeking to serve their communities through social action and by offering services such as health and social care, childcare, housing and welfare to work.
That's right.
And during the pandemic, you sat on the National Faith Task Force, which was tasked by government departments to ensure that faith communities were supported and able to respond to COVID-19 impacts and to assist with policy.
Yes.
And then to assist with that task, you held weekly focus groups with representatives from 9 different faith communities. Could you outline which those were, please?
They were with Christian, Muslim, Jewish groups, Baha'i, Sikh, Hindu, and Jain, Zoroastrian, and Buddhist.
And could you tell the inquiry, please, what sort of things week to week you were discussing in those focus groups?
In those groups, we would explore any recent information related to regulation, any information we were getting through in terms of any questions that were coming to us from the Communities Department. We also were taking soundings on what was happening in faith groups, how they were responding, how they were doing their services, their spiritual services, but also their social activities as well, and essentially starting to gain understanding of what was happening with those communities and then to feed back that information into government.
And can you tell us what you consider the importance of the National Faith Task Force to have been?
The task force was unique in the fact that there was not a sitting group of faith representation. And initially, the focus was on regulations and on closing place of worship and then the reopening place of worship. But very rapidly, there started to be an understanding that faith itself can be an asset rather than a problem, rather than a risk to communities, that actually faith groups were involved with providing medicines, with providing food. And so therefore it became a coordination point where we could wrestle through different development of regulations and to try to lever the possibilities of faith for the benefit of the UK.
And much of your statement, Mr. Singleton, that you've provided sets out both the impact that you say that you learnt from these focus groups, but also, as you say, the positives that the task force was able to do in collaboration with different agencies.
Yes, that's so.
Now, I'm going to start by asking Mr. Singleton then about the impacts in the early stages of the pandemic. That's impacts on members of faith groups and then on places of worship. And this is with the backdrop in that initial stage of places of worship closing in that full lockdown, and then moving to reopening for private prayer across the UK from May and June 2020. And from paragraph 11.1 of your statement, you discuss the impact on the mental health and well-being of people of faith. Could you tell us, please, what were the main issues arising from that first lockdown which impacted the mental health of people of faith?
One of the biggest issues that people faced was related to death. I mean, life cycle events generally were a big focus of our discussions. But as COVID hit the population and we started to see deaths, particularly issues around send-offs, so the funeral arrangements were particularly brought up, and the restrictions were keenly felt by different members of the faith community. I think also we started to get growing information about how faith was adapting and supporting people, but predominantly the discussions in this part of my evidence are about life cycle events and funerals.
There would also have been impacts on people's experiences of prayer.
Yes. So those whole discussions about how some kind of service can maintain, some kind of faith service can maintain, and what was appropriate, what could move to online and what couldn't, and what could be done, what people could do within family settings, all those things became very complicated because there were different restrictions or different traditions within different faiths.
And we'll move on to the experiences of the move online and different experiences of certain restrictions shortly, Mr. Singleton. Presumably, though, it wasn't just members of the groups, but also faith leaders themselves who were being affected by that first lockdown.
Yeah, obviously, like everyone else in society, faith leaders were not particularly ready for this, and the levels of not knowing what was going to happen, and people did turn to faith leaders with the expectation that they would be able to walk them through. And obviously, faith leaders were suffering particular issues like the rest of the population, and some of them were facing increased deaths. There's one comment I give about a Buddhist chaplain who talks about a rise of funerals and rise of suicides and different things that he was dealing with. So there was quite significant pressure on faith leaders, and quite early on in lockdown, we were getting a number of reports of a kind of fatigue on faith leaders as well. And I think particularly if you understand that there are some faith leaders obviously who are professional, but there's quite a lot of support that comes from volunteers, and that was therefore restricted in terms of how people could help in that way.
Yes, just touching on the fatigue that you mentioned, there's talk in your statement of moral injury, which the inquiry heard during evidence last week about. Can you say how that moral injury comes about through faith leaders? Is it that being close to so many people being bereaved in those early stages?
I think it was being close but not being able to respond to people in the way that we would want to do from a human perspective. I think just the very nature of not being able to be in proximity, not being able to console, not being able to pray, to embrace, and all those kind of things. Those are all issues that were faced to different degrees, but and particular communities obviously were hit in particular ways. So therefore there were some that were hit more severely, and therefore there was not respite.
Perhaps one example of the provision of in-person pastoral care being affected actually appears in the Faith Groups and Places of Worship Roundtable, which I think was attended by yourself, Mr. Singleton, as well as representatives across various religions. If I could just ask for that slide to be put up on the screen. It's page 12, paragraph 31. And I'll just read this out. Representatives described how in-person pastoral care is a core part of religious life for many faith communities. This includes faith leaders and other members of faith communities visiting people in their homes and hospitals when they are ill or need help. During the pandemic, this was restricted, leaving people without the support that they would usually have had. So the impact that we see in that early stage on local faith leaders, in turn, is itself impacting the people who need that care even more at that most important time.
You have this situation where people are wanting to help, want to reach other people, sometimes even to put themselves at risk, but they're unable to do that thing. And so there's a kind of a double issue. They've got the people who need to receive the care and the people who want to give the care, and both are not unable to give it. And one example that we we were able to see that in Brighton, the Hospital Trust worked together with faith groups to allow voluntary chaplains to come in, because in many hospitals, unless you were an employee, and many chaplains are volunteers, they were not allowed to go in. But in Brighton, they were able to work together with faiths to allow, so people particularly from minority faith, were able to have a chaplain from their own faith, and that's kind of a positive story of people working together in that sense.
And then, just moving on to the type of care that was being provided by members of faith communities in these early stages, I'm going to ask to be shown page 13 of a Faith Action report. This is titled "First In, Last Out: How Faith-Based Organisations Have Supported NHS Services During the COVID-19 Pandemic and What This Means for the Future." And there, Mr. Singleton, on the screen we can see a bar chart. This has the title "Mental Health and Spiritual/Pastoral Support." And this is a report which was exhibited to your statement. That details the results of a survey conducted by Faith Action covering what members did in 2020. So are you able, please, to talk us through what this page and this graphic shows?
Yeah. Well, what we see here, it's always difficult to split spiritual and mental health support within a faith setting, because people often just get on and do it. But what we were able to do in this survey is to actually see the significant growth in mental health support that was done during the pandemic. And what we see on the other side is a corresponding slight decrease of what would be considered spiritual and pastoral. And as we explored that, what we saw is that in many ways, faith leaders and faith communities were responding to broader needs than just what could be termed spiritual activity. So prayer and visiting, those kind of things, were down a bit, but there was a significant increase in different forms of mental health support and well-being, and trying to link people, online cafes and different things like that. And some of our other statistics within this report show an increase in all of those kind of what you may call social. I find it a difficult thing to separate social and spiritual in that sense, but it's those different endeavours that we do as humans. So we see an uptick of those.
So very broadly speaking, then, this is a reflection of the fact that there is a greater impact on people of faith communities, and we see in this bar chart people responding to that greater impact by the provision of social support.
That's right. That's right.
You also have mentioned moments ago, and you mentioned in your statement, a decline in the numbers of volunteers. Could you help us first with quite what you mean by volunteers in this context?
Yeah, it's always difficult to kind of outline volunteering within a faith setting, because many faiths have the position of not wanting to make a big noise about volunteering. People get on and do it in that sense. But certainly what we saw was, although there was an increase maybe of people from a working age, furlough potentially helped that, and different restrictions that people volunteered in those ways. There was a reduction on those who potentially are more traditionally around, particularly temples and gurdwaras, those people that are part of providing langar and different things. So there was a drop-off because they were considered part of the vulnerable, and because of the restrictions upon those things. So there was that kind of suppression of classic volunteering, although for periods of time within lockdown there was an increase of new volunteers coming in.
And so bringing it back round to impact again, is the impact of that there is less tailored volunteering in those early months to specific faith communities?
I think that the very nature of physical restrictions meant that while we were in total lockdown, there was just not opportunities. And it took a little while for faith communities to start working around how are they going to provide food, how are they going to provide the community kitchen and things like that. So that people got there if they had the volunteer base. And on some smaller settings, if you're a smaller Gurdwara with an older population, then you've not necessarily got the people are shielding and and there's a fear factor as well, I think we have to recognise. So there was a kind of initial shock in some settings, whereas others pressed on and increased. So in terms of tailored opportunities, there was restrictions, and when we talk about internet access, that was obviously an issue. But some of those, there were issues there in terms of providing for people because there was a lack of understanding of what was safe and what we could do and what regulations would allow.
I'm going to move on now, Mr. Singleton, to positive impact in those early stages, and much of this is taken from the Faith Groups and Places of Worship Roundtable. I'm just going to read a few passages, and if you could then comment from there. Firstly, from paragraph 12, representatives shared how the pandemic gave some people an opportunity to reconnect with their faith individually and with their community, and how this improved their sense of religious well-being. The quote there, "It was encouraging to see how much faith meant to people and to see people reconnecting with church during the pandemic." The following quote, provided by the Muslim Council of Britain, "The way people demonstrated their sense of godliness was their service to others." We see mention there in paragraph 13 of how religious communities supported vulnerable people, ensuring those in need received help with essentials such as food parcels and medication, emotional support via the phone to those isolated, and then again further down, paragraph 14, that faith leaders acted as a trusted source of information about key issues like government restrictions. And I know that's something that you'll help us with when we talk about collaboration, Mr. Singleton. But while we have this deep sense of distress then in those early months of lockdown and loss for people from faith communities, we see here that people of faith were helping to mitigate that loss felt and the losses felt by others in society by helping.
Yeah. I think, we use the term for our report to be first in and last out, and I think that's what we often see with faith. It's the first to respond to particular issues and the last to leave a situation, and we saw that definitely so within COVID. I think the other factor is that people became much more aware in our daily lives of death and the desire to connect with something beyond kind of where we are at the moment. So I think it kind of focused people a bit more, and so therefore and they did gravitate and there were then opportunities to gravitate and connect with faith in new ways. So there was a kind of mobilizing, and there was a collective endeavor in terms of those things, and people could practically see what they could do, where there was the organizing power to enable that. And that was sometimes the restriction, where there was organizing power to do that, particularly when we talk about smaller settings with older populations. That was often a restriction.
I'm going to move on now to the impact on places of worship. And would it be right to say, firstly, that such a large impact for places of worship in that initial phase was the financial one?
It certainly was significant, because what we were led to understand was that there is a lot of I suppose for one better term, trading that is done. So a number of bigger venues a bigger place of worship will have conference facilities. They will have charity shops. They'll have different things where there can be income, but also as people come as part of their weekly attendance, people would give donations, and therefore all that stuff slowed down. Now, obviously, there was a move for some of that to go online and to be done electronically, but again, you're hitting that same part of the population, potentially the older people who are not necessarily used to doing that and are more into a kind of a cash approach. So that lack of footfall, and you get that kind of slight out of sight, out of mind thing that did have a particular impact.
And that would be across various faith communities?
Yes, pretty much, yeah.
There was a paper published and disclosed in Module 10 called The Impact of the COVID-19 Pandemic on the Exercise of Religion in the UK, published in 2020. That states, that has the INQ reference number, INQ 000657129. I'm not going to ask for this to be shown on screen, I'll just read a passage from it, but that says that income results not only from casual donations and admission fees to cathedrals and major churches, but also smaller churches and meeting houses which might ordinarily offer conference facilities for hire, and that's described as a critical source of income which evaporated with lockdown. And it adds to the article that unfortunately some of the charity or small business grant schemes didn't apply to these places of worship. So as you say, it's not the decrease in footfall necessarily alone that has the financial impact, but the extracurricular bookings.
Yeah. And the way the tax, the way the money was funded back because of business rates and relief and that kind of thing, if you're not receiving those, then you don't get that relief as well. And that's what, particularly in that paper that comes out, that there's some of those mechanisms that were done according to small businesses and small charities didn't work necessarily for places of worship. And there is still obviously the cost. You still have insurance costs. You still have to maintain some of those things, even if a place has not been used. And then obviously there's increased cleaning costs as we come into moving back into.
So is it the case that prior to the start of the pandemic, there might have already been a delicate financial situation with places of worship?
Yeah, for some that would definitely be the case, and particularly smaller venues. But on some of the larger things, if you're not getting those large conferences in those particular events, then that all becomes a bit of an issue there. So it is a bit precarious, and you can't do the appeals. You might do an appeal to your community to get finances in, but you can't do that as easily when you're not seeing people face to face.
And then what are the wider implications of these places of worship suddenly starting to really struggle financially? Well,
they're unable to provide some of the services, and some of them it would probably speed up their closing in that sense. There is coming out of lockdown. There are issues with smaller locations. And so that's kind of that obviously comes up. And I think in that sense, maybe COVID has been an accelerator on that in terms of those fabrics, those things that are in society. But once people fall out of the pattern of giving, it's sometimes harder to get that going again. But that certainly was something brought up at the time in particular locations. Some locations moved online and electronic, and they saw little differences. But many of these where their location was a key way of earning money have expressed concern.
And I'll just read some extracts from some further reports which might illuminate the extent of the financial impact being had on places of worship. Firstly, in a paper published by Dr. Gladys Gagniel at Queen's University Belfast, this is called People Still Need Us, INQ 000596901, and this is from a Presbyterian in Northern Ireland who says the big thing is how this is financially utterly devastating. My congregation estimates a loss through 3 areas of estimated £20,000 of income in the 3-month period, April, May, June. And my congregation runs a separate charity, and for the charity, the effects of the closure of groups and activities are severe. And before I ask you to comment, one more extract from a further article, The COVID Cash Crisis for Religion, document INQ 000660009, states, this shortage of money has also shrunk the funds available for social action. Other Muslim and Sikh leaders have told the RMC, that's the Religion Media Centre, that charitable giving is being squeezed at both ends since more of their congregations need help and fewer worshippers have the money to give away. And then finally, there's a quote provided by a treasurer from the Catholic Diocese in Birmingham, which reads, we are giving people the opportunity to exercise the charism of giving by donating online. But I do believe, he says, we will survive with God's help. He fed 5,000 with a couple of loaves and fishes. So that illustrates, perhaps quite aptly, what places of worship need resources for. They seek to give what loaves and fishes they have to the many, but in the pandemic, their loaves and fishes are depleting in number and they're relying on a miracle to provide to others.
Yes, and that is it's a good picture in that sense. You need something to be able to give, and even if we think back to that social versus spiritual or pastoral thing, that there was a need for food, there was a need for medicines to be collected and transported, and all those kind of things. So we see faith groups stepping into the gap often, and yet on less resources. And of course, just because that happens during COVID doesn't mean that problem goes away, that it becomes a place to track to. And therefore part of what we do from a Faith Action side, we seek to enable those faith groups to get funding from other resources as well. But we've moved from one crisis to another, very much hot on energy and then a cost of living crisis. There's not many loaves left, as you said before, Councillor.
Well, I'll move on now to the next phase in the timeline, the easing of restrictions and the differing impacts experienced whilst those restrictions were eased. Firstly, in relation to how groups experienced the return to worship in person from May, June 2020. It was different across different devolved nations. And then we know that in July, restrictions began to ease for public worship. But you discuss in your statement, this is from paragraph 4.2, the various groups that could not or did not simply return with those initial easings. Could you tell us who they were, please?
Well, there was an issue, obviously, with those who were vulnerable coming back, and part of the issue was the nature of regulation itself didn't always allow for faith practices in themselves. And
sorry to cut you off, Mr. Singleton. In fact, on that note, we heard this morning from Miss Wong for the Clinically Vulnerable Families explain how clinically vulnerable people, as you were just referring to, felt excluded from their faith as a result of not being able to go back in these initial periods of restrictions.
Yes, and I think it's worthwhile recognising that often it was the clinically vulnerable in particular communities and older people who were more likely to be frequenting those faith locations, partly because maybe not being in a workplace, or that there was a good footfall, and I think particularly of older people within South Asian communities, particularly at Hindu and Sikh settings. So there was a fear factor. I think that government messaging was quite successful in creating fear, but then to overcome fear was a big issue. And then how to apply the restrictions on place of worship, that was difficult. The language often had a kind of Anglican high church kind of backdrop, which didn't allow for more community-based activities from maybe a Sikh and a Hindu perspective, but even from a charismatic or Pentecostal setting. Often, even the term private prayer was a problem in itself, because that doesn't mean something. people, I think, felt that they were releasing a whole bunch of stuff, that people could come into cathedrals and churches and have private prayer. But actually, in many settings, that has it's no real value. You don't necessarily go to a place of worship for private prayer. You can do that at home, but it's more corporate activities. So therefore, there was a sense that there was a kind of a two-tier or triple-tier system where some were able to start having a significant degree of their faith practice they were able to move into, where others were felt completely restricted still. And I think one of the things it's worth noting is that by this time, we knew that outside was pretty safe. And there was not the corresponding intelligence or literacy to realise actually there could be a bunch of stuff that's done outside, and therefore there was these constant restrictions about trying to do things inside. So we had many discussions and people trying to find ways around and work, and part of our desire was to try to talk about what was safe and to work and to try and give some logic to sometimes restrictions that didn't seem to have a great logic to them.
Just want to expand a little on part of the answer that you just gave in relation to private prayer and that not really transferring across different religions. Could you just explain that and which religions in particular might have been excluded by the use of that terminology?
Well, within... It is interesting to see how people decided to interpret this, but I was working particularly, I was running our group for Sikh communities, and within Sikhism that there is the concept that you come into the Gurdwara to be in the presence. Now, for maybe people from different faith grounds, that could look like silent prayer, but that's not what it's called and not how it's regarded. So therefore, in some Gurdwaras, they did do that. They allowed that. Others wouldn't. And so therefore, there's an example there. And I think, again, private prayer within maybe a West African Pentecostal setting, well, you can be praying individually, but it's going to be potentially quite exuberant, quite energetic, and in a COVID sense, maybe slightly more or somewhat more dangerous because of the issue of airborne. So those restrictions it's if you were from a high church Anglican perspective, it made sense, but it didn't make sense in other settings. And I think part of the problem was there, rather than describing what was safe, government got into trying to be very prescriptive about particular practices without really knowing what they were.
You also, in your statement, mentioned that some women didn't feel that they could as easily return to in-person prayer. Why would that have been?
Yeah, so I think one of the things within some settings, we have to remember that faith, places of worship come in all different sizes, and within some Muslim communities there was not the space given for safe settings that women could attend as well as men. And then there were issues with children attending as well, so that created further restrictions. So partly we have to realise that not every faith setting is a church surrounded by countryside. Some of these are shop fronts. Some of these are very small locations. Some are, so therefore it's quite difficult for people to have different restrictions, and also sometimes priorities are given to one part of the faith community over another. And
indeed, in the roundtable, I won't ask for this to be put on screen. There's discussion of certain demographics feeling particularly affected even within their religious communities. There's discussion of the impact of measures like contact tracing. The roundtable at paragraph 47 says that the representative for Muslim Council of Britain spoke about how providing details for contact tracing was a barrier to practicing faith for some of those in their communities because of concerns about the prevent duty or immigration enforcement.
Yeah, and I think that was also picked up by parts of the Jewish community as well, a concern. I think we have to remember the context which we live in today of a growing distrust of authority. and therefore, why do people need this information? What they're going to do with it? What's going to happen with it? The contract tracing and issues about the contents of the inoculations and all those kind of things, they all kind of was part of the same concern, which we were trying to understand and get past, but. There was, because of the relationship that government has had with certain faith groups and its kind of restricted view or lack of faith literacy, as many people say, that there's a lack of trust, and I think that's one of the key factors here. That part of the impact of COVID has been a decline of trust, certainly within society, but definitely between faith and government in that sense.
And we'll come round towards the end of your evidence on how faith communities can be well placed to challenge that position that's emerged. But ultimately, bringing this section back round to impact, is it right then that despite this initial easing of restrictions, there are still some people who can't engage in their ritual or their worship, so they're still being impacted as though they were still in those extreme early days of full lockdown?
Yeah, I think so, and I think it's to different degrees. I think that's the thing, that some felt that we had some feel back to come back that they were going to hang on. I think some of the initial restrictions started easing up over the summer. Some said we're going to wait until September. We're not going to even attempt to do things, because if we can't all come back, we don't want to just have one part of the community, not the other part of the community, and certainly that's what we pick up, even with the stuff about women and older people. Some faith communities said, listen, if we can't have everyone, we don't want to do it at all. Let's have the same amount of restrictions. So it did affect different groups in different ways, and people dealt with it in different ways.
And did Faith Action see any compound impact on these people as a result of having been further excluded and isolated, seeing other members of their community engaging with their faith in a way that they couldn't?
I think there were levels of frustration, and sometimes there would be queries between one faith group and another, or even between parts of the same faith, some discussion. And certainly we were part of the benefit of having the round tables we had, is that we actually gave a place within a single faith setting for people to discuss and to talk, and we could then advise and say, well, this is how we understand the regulations to be, and people could play it out. But that's if they found their way to us and we were able to curate that discussion, but it wasn't always possible in that sense. And there was a sense that people were left behind. On the other side, there were people who had been restricted in attending places of worship because everyone went online during restrictions. There was a kind of equality of lack of access in that sense, and therefore there was all in it together but not together, so to speak.
And before we move on to those different experiences of restrictions in particular, I'd like to move on to how the easing of the restrictions was perceived among different faith communities. Now, you explain from paragraph 12.1 a disappointment across the board at the perceived prioritisation of places such as pubs, bars and restaurants over places of worship in the easing of restrictions.
Yeah, I mean, one of the issues, I think we understand that people need access to food, and that's essential. But I think it's the term non-essential that faith got lumped with, and what we have seen is that faith is pretty essential to people, and therefore the perception that economy was to be prioritised over faith practice was something that people were particularly upset and concerned about. And I think also it showed a level of lack of understanding of the support and the social glue and the well-being support that faith could provide. That actually it's a one-stop shop for many of those things, certainly from a mental health perspective, that could help people. So the fact that restrictions were only eased up And then there was quite a bit of discussion had to go. In the task force, we had to write an open letter to the Prime Minister about releasing places of worship earlier on and to present evidence on that. So there was a reticence to allow places of worship to open. And then, of course, as soon as you see pubs and bars, etc., open, you do see some spike around those locations, which we didn't see around places of worship.
And just to bring this back round to impact, Mr. Singleton, I'm going to ask for a page from the same faith groups roundtable to be put on screen. This is at paragraph 15. We see there representatives repeatedly emphasise the centrality of personal faith, religious practice and religious community for many people. Representatives felt frustrated by what they described as a lack of understanding that religious practice is a core aspect of people of faith's identity. And then a quote on the following page: for many people, faith is essential, and it was being banded with non-essential things like swimming pools. It was offensive. It wasn't intended, but that is how it came across. Yeah. So, thinking again of impact, Mr. Singleton, what's the particular impact on religious groups of this feeling, the perception of deprioritisation?
Well, I think that I mean, that's a good quote. It wasn't intended to be offensive, but it was. I think is a good way of putting it, and I think it compounds the view. The impact is that government, public sector doesn't understand faith, and then it does contribute to a lack of trust in that sense. And I think during the faith responded pretty strongly to try to prove itself as being an asset, but I think there was a sense of, yet again, because there are various restrictions at various points, yet again there's not an appreciation of that. So there's a sense of a kind of offence in that sense, and I think there was, and because faith was responding to things like mental health, to all those kind of things where there was not the ability to access doctors and medical support in the same way, then there was this kind of lack of gratitude, lack of appreciation in that sense.
I'm going to ask you next about how specific practices and rituals were affected by the restrictions that remained in place. So we've touched on the fact that they were affected, but some particular examples you discuss in your statement, and you've mentioned already the centrality of certain practices to people's religion, to the extent that after an initial rise in attendances in July, that by late July attendances were dropping, such as the importance of being able to carry out those rituals to the full. Yeah,
and I think that there was, I think, like anyone, people of faith, we'd all been locked up. So any freedom was people were keen to use, and where a place of worship could utilise some of the freedoms, then there was an opening up. But then there was the dropping back, because actually you couldn't express yourself the way that you wanted to do it. And I think there is an importance of understanding that I was in a briefing just before lockdown, and I think it was a deputy medical officer said at that point her concern was not the football match, it was the pub beforehand and the taxi afterwards. And I think that was part of what we realised, is that it's not always what goes on in the church or the mosque. Those things could be controlled, but there's a lot of the social activities that happen, the greeting each other and all those kind of things. And if you can't do that bit, it's not part of the full experience. And that's if you can express your faith, but if there's certain rituals and things you can't do, then you're not really doing it at all. So it's a kind of a half-cocked kind of experience.
Yes, and some of the examples that you give, guidance was that singing was not allowed in places of worship. That would impact the practices of a number of religions.
Yeah.
In fact, as you've said already, some places didn't consider opening until they knew that they could all sing or chant properly. You mentioned Buddhists being one of those religions, or religious people who weren't able to chant as a result of the restrictions. There's an added issue for Muslims who ordinarily would take off one's shoes before going in to pray. There's discussion in the roundtable of other practices such as the Eucharist or Holy Communion that weren't able to be carried out. So those are just a few examples of specific practices.
Yeah, and singing was one of the key factors for many, and chanting as well. And also remember, that's one that, again, performance singing was allowed before worship singing was allowed in that sense. So that there was this disparagement between it. There was a little bit of research. Again, as part of the task force, there was some research done on singing. We pressed the government to do that. It was relatively inconclusive, but I don't think there was sufficient understanding about the importance of corporate singing, chanting, to do the investigation to see what was safe or not. Again, the suspicion would be outside. We'd have the Black Lives Matter protests. There was not a spike after that. There was chants and calls and that kind of thing. So therefore, outside should have been appropriate for those things, but that didn't filter through. So then you've got that, again, that offence where this can happen and these people can do this kind of thing, and then why can't we do what we want to do?
We then come to events. You started your evidence saying how it was these life cycle events that impacted people the most, the loss of them, being able to carry those out. The inquiry's heard already of the disruption to funeral practices, the impact that had on the bereaved, and we'll hear more about it in the next week. But you discuss weddings as well and religious practices that tie in with these events. You label these as important spiritual and community events for many faiths. And you break this down from paragraph 7.2 of your statement into how different communities' weddings were impacted. Could you talk us through just a few of those examples, please?
So different groups have different practices, and therefore the limit of participants was always going to be an issue. I remember particularly in approaching summer 2020 that there was a lot of discussion with Jewish groups, because for more Orthodox Jews with particular festivals hitting at particular points, there were only very small windows of opportunity, and there are certain rules within some communities about needing to have at least 10 men, and therefore for the thing to be seen as a wedding. I think there's the quote there about, and this was, I think, from a more Christian perspective, about doing ceremonies before the sight of God rather than waiting for a legal ceremony. So there was some adaptation that was used, but many people held off doing those wedding services and those kind of things, because it became quite a problem because of the restriction of numbers and all those kind of things. And sometimes when people did try to do some stuff where people were living close to one another, sometimes people would get together if their houses were next to each other, do stuff in the gardens and try to do stuff so they had their numbers together. Sometimes that was frowned on by authorities as well, even though technically it was all right. So there was some flexibility, but for many people within faith settings, weddings, obviously funerals we'll come to, but weddings are more important to be done within a religious setting than they are in a legal setting. So therefore, restrictions to those practices were felt more fundamentally. And I know myself, within my faith community, there were a number of weddings done, or I heard of friends that did weddings on beaches, and people could drive up parts of Northern Ireland where you can drive on the beach and that kind of thing, and I think they had fish and chips for their wedding breakfast. It probably saved them a lot of money, but generally I don't think that worked that well. And so therefore, you've had these key life events that you've not done in the sight of things, and you've got and life moves on. If I can give a personal example, my father was diagnosed with motor neuron disease a week before lockdown. We were told it was already in the vulnerable stage. As we left the consultant, he turned to us and said, "You must hide from this disease." So I brought my brothers in to tell them the news and sat them in two corners of the room. And a couple of weeks later, I was on the phone to my father and he said, "I'm looking forward to having a hug." But COVID and restrictions meant that he was never able to hug me again because he'd lost use of his arms. Now, it's not a life cycle event, but it's an interesting thing about how that was a personal impact we were never able to embrace again. And I think in life cycle events, there is that need for that human contact. And because of the nature of the disease, because of the nature of things we had to do, those opportunities were taken away from people. And we see that particularly, obviously, as we look at funerals as well.
And on funerals, in fact, I'll just ask, in fact, for a page to be brought up from the Faith Groups and Places of Worship Roundtable at paragraph 26. This states representatives across different religions felt that restrictions on funerals were one of the main impacts on their faith communities during the pandemic, affecting people's well-being and ability to grieve in a way that reflected the traditions of their faith. So it comes back to faith, doesn't it, Mr. Singleton? Then the quote from Churches Together Scotland: "The best parts of faith practice supporting people through bereavement were denied by COVID-19, which has left scars and has drained a lot of people's emotional energy along the way." Now, again, focusing on the religious aspect to bereavement, because we will be discussing bereavement in the inquiry in the next week or so. Are you able to give some examples of specific, again, religious practices which would have been invariably impacted when it came to the pandemic and bereavement?
Yeah, I believe in our evidence we give some example of ritual washing that is common with a number of religions, and sometimes that was allowed, sometimes it wasn't allowed. Sometimes because of different types of regulation, often because there was the interpretation at local level. I think the biggest issue probably that came up that we were aware of was the desire within Jewish and Muslim communities to have a burial within 24 hours. And depending on the nature of the area, the nature of what was going on, in terms of funeral facilities, that often was not we weren't able to do that. And I think that created, you've got people who are parting and you're unable to do the thing that you want to do and the thing that your community expects and the thing that your relative expects you to do. So I think that creates, you can never have that time again. And I think that's a tricky thing. In some ways, a wedding, hopefully those people will be around for you to celebrate and do something with, but a funeral, it's your last go. And so that was often something that we had quoted. And some areas and some directors of public health were creative on that, but many weren't able to do that. And obviously in some parts of the country there were greater rates of death within particular communities than others, and that creates issues.
And an example, in fact, bringing that together with the issue of being buried within 24 hours of passing, comes up in the Bereavement Every Story Matters report. And my lady, this is INQ 000659894. Going to ask for page 32 to be put on screen. That passage from a bereaved daughter in England reads: "Culturally and religiously, you're meant to be buried within 24 hours of passing away and return to the ground, kind of thing, to the earth. But with COVID, that totally destroyed all of it, and it affected the Muslim community hugely. My father's funeral was about 2 weeks later, maybe even 2.5 weeks later, which is quite shocking an unusual and unheard of. And what was happening at that time is that there were loads of bodies just in, I guess, morgues. And it's because of the faith ritual around bereavement that has an added impact on this bereaved person in England.
Yes.
Moving on to an even broader event, religious festivals being affected. Now, the round table, I'm going to ask again for paragraph 44 to be put on screen. This is the Places of Worship round table again. This is about the timing of restrictions in December 2020. Explains how this affected carol service, midnight masses, Christmas Day services, and representatives explained that the timing of these lockdowns was difficult and disappointing for those preparing to observe these important festivals, and for religious leaders who had to change plans quickly there at the end of the paragraph. In your statement from paragraph 8, you discussed the timing of the local lockdowns in July 2020 and the impact that had on the Muslim community. Could you expand a little on that, please?
Yeah, different announcements happened at different stages, but certainly there was a sense coming from our Muslim round table members that there was a particular anti-Eid kind of approach. And one of the things that we saw consistently is their announcements and regulations always came out, it felt very late, and often without, and I think the example that you read about the Christmas stuff, the information comes out very late and it gives very little time for people to respond to it, and that was certainly the case with Eid. There was also a denial from government that there was a restriction aimed at Eid, and yet Muslim members of our group said they could see some issue because, again, that human contact thing again, that people want to celebrate, they want to pray and hug and those kind of things, but that was denied as a particular issue. So you see that root of trust coming in there. The government says one thing, but the communities think something else. The other issue was, I felt, was about Christmas being allowed, but New Year's not. And I think it's interesting, Council, just to note that there's religion and there's culture, and they tend to roll together, so that part of our feedback is that Christmas could be regarded as a festival predominantly for white communities, but actually that even within Christianity, the black churches, the Afro-Caribbean churches, the West African churches are much more likely to have a bigger celebration when it comes to New Year's. So then you had this pattern of, it seems to be, again, Anglo church basis that seemed to be doing all right, although on this particular thing, late notice, that was an issue. So again, the impact is this perception that there are some who are doing better than others within faith communities, but often broader than faith communities.
Well, that leads me to the next set of questions, Mr. Singleton. Looking at the perception of the prioritisation of Anglo-Christian traditions in either the making or the easing of restrictions. Now, that's a concern that you highlight in your statement that you were witness to in your role at Faith Action during the pandemic. Was it discussed at weekly meetings?
Yeah, it often came up with the consultations we were doing with faith groups. There was a level of discussion even in the task force and with individual officials that were relatively well versed on what was going on in faith communities that was recognised, but it always felt that sometimes decisions were being made somewhat further away than the information we were getting through, and there was this kind of, it felt like there was always an assumption of a Anglo-Catholic kind of religion, and therefore that meant that particular groups felt neglected, and those potentially were the groups that, of course, were most affected by COVID itself, being those within particular ethnicities and those who are often within the NHS and working and taking risks in those sense. So there was this constant discussion going on, and most times you could point out the regulations and how it made sense, but there were times like the Christmas and New Year thing, it just didn't make sense in that. It's hard to justify.
And so if different members of different faith communities are experiencing things differently across the board, perhaps to Anglo-Christian traditions, then again, the impact on those other communities, for want of a better word, is more exaggerated because they can't access the coping mechanisms that they turn to faith for.
Yeah. So you've got that sense. You feel neglected. You're also feeling restricted in that sense. And it seems that others are doing all right. I would say that rarely did we have any tension between faith groups. No. So we would do multi-faith settings, and we rarely had any sense of tension between them. So it was directed towards government in that sense, but there was often the phrase, they don't understand us, they're not interested, or those kind of things.
And on that, I'll ask for another page to be put on screen, please. This time, paragraph 39 of the Faith Groups Roundtable. It reads, representatives for the Muslim Council of Britain and the Hindu Council UK felt that they had limited access to the government during the pandemic. The representative for the Muslim Council of Britain felt that having limited engagement with the government meant that they had to do their own tailoring of guidance, leading to concerns early on in the pandemic about communicating the wrong message without government reassurance. So again, Mr. Singleton, it's this perception of not being catered for in the guidance, and the result, at least here, appears to be that representatives are having to interpret the guidance in a less clear way than, say, perhaps someone in the Anglo-Christian community might.
Yeah, and it depends on the expertise that different communities can draw on in that sense as well. So the Catholic bishops have great representation of people with public health knowledge, and actually within the Muslim community, BIMA is a very good medical organisation to connect to. But part of what we see here, part of the impact, is that government did not have and continues not to have consistent ways of connecting with faith groups and getting under the surface of what's happening. So therefore those routes through own testing, even the nature of regulations, when you looked up faith places of worship regulations, you had to jump from page to page, going from business to education to all different things, because it wasn't put together in a coherent fashion for faith in that sense. So being able to double check and go back was part of the problem in that sense.
And so the importance here is that greater communication, collaboration between all groups and agencies is key to ensuring that people don't feel left behind and allowing them to continue engaging in their faith practices, which themselves are often coping mechanisms. Yeah. Before we move on to innovations, I'd just like to show one more paragraph from the Faith Groups Roundtable. This is paragraph 17, and this reads, some representatives described how members of their communities experienced racism and were targeted by conspiracy theorists during the pandemic. The representative for the Jewish Leadership Council shared that there was a negative impact on the well-being of the Jewish community caused by a conspiracy theory that COVID-19 was a Jewish disease and that this led to an increase in anti-Semitism. The Muslim Council of Britain representative described how political criticism of the Muslim community, whose gatherings had been said to have spread COVID-19, resulted in negative comments within the press and wider public discourse, leading to a sense that their religion had been singled out. So here, Mr. Singleton, we have some examples how simply being a member of a certain faith would have impacted individuals.
Yeah, and we have to remember people had a lot more time and a lot more access to internet and various different rumours would spread very swiftly, and we'll see that when we go on to looking at things like vaccinations. So there were various conspiracy theories that kind of kicked around, but both the Jewish community and the Muslim community were more victims of COVID in many senses as well, because of particular ways it hit particular areas, and so it's tough when you're getting conspiracy theories thrown against you and you're suffering the real physical danger at the same time. So there was a level to things flying around, and it was difficult for particular groups within that time. But when pressure comes, you tend to get those things, as we see today. So.
Well, I'll move on now to innovations among faith communities. Now, we've touched already on the move online, and we've heard evidence of the move online and its impact on people with mental health problems before. So I just want to touch lightly on this, that invariably there was a necessity to move things associated with people's faith online. There were worship services held online, is that right?
Yeah, I mean, one of the issues with online is you can't sing or chant together. There's a lag. It can be performed, but you can't join in or hear each other in that sense. So, and any call or response would have that same lag, that same issue.
So it's still exclusive of certain rituals, practices. Certain communities, there's mention in the Roundtable report of technology itself not being permitted on the Sabbath for Orthodox Jews, so they couldn't have the move online the same way that other communities did.
And I think it's important to note that you can have a silver bullet theory. Oh, everyone can do everything online. You look at the practice, but then forget that actually, no, Orthodox Jews can't operate technology in that sense. So that again we often term that as faith literacy, but it's actually working out. Okay, it can't happen for this reason. It's not as easy as opening a restaurant or there's different restrictions.
And there's mention in your statement of the centrality of the place of worship itself and the importance of church to perhaps Christians' experiences in their faith. There's a specific example of the move online that you reference, enabling over 1.5 million people to watch teachings from the Dalai Lama. So there were positives to be taken from the move online, but perhaps not universal. Moving on then to other innovations or action that we can learn from going forward. One thing that seems to come through your statement and the Roundtable and throughout your evidence today is the increase in collaboration across the board and the positives that have been brought from that in the pandemic. We've spoken already about the increase in certain volunteer social community activities, delivering groceries, supplying food parcels. So there's that increased sense of community and the importance of that. Are you able to say how that ties in with faith?
So the faith being the first port of call in that sense, and having access to communities and knowing what's happening at different areas. Already there is a strong network within the UK of food banks. Most of them are located at places of worship. So there's already some factors there. And I think in our reports we talk about an increasing of help. People didn't necessarily innovate completely new things, but they developed more of what they were doing. So that was extended. And if you have a relational bridge, if you have some kind of mechanism already in place, if you're delivering food, you probably can deliver medicines, or you can go and visit people in their gardens or do different things like that. So there was a case of retooling relationships. So and we saw that in particular areas which have got the faith covenant. So that was brought together. So for instance, I think in Essex it was brought together around mental health before COVID, but then it was retooled for different things because it already existed and people knew each other. And to some extent, because officialdom wasn't necessarily in place, other means had to be taken up. So the chair of the all-party parliamentary group at the time, Stephen Timms, talks about in Newham how he was contacted by the council and said if people contact the constituency office and ask for food, that to phone this particular vicar and he will ensure that there's food by 10 o'clock at night. So there was a swift response from faith to those kind of things, while to some extent the state took a while to come into place because of the mechanisms, because they're already kind of light on their feet to respond.
And again, bringing it back round to impact, that's as a result of there being a greater impact on people in the community and people in faith communities seeking to step in and help where they can. Yeah,
and we have to remember that faith in itself, it's not just a badge of identity. It's a set of beliefs in that sense, and all faiths pretty much have a duty to the widow and the orphan. The widow are those without economic independence in today's society, and the orphans are those without a place of belonging. So that there's quite a broad area that faith would feel that it needs to respond. There's a duty to respond. There's not necessarily a choice there. There's a sense that because of our faith, we need to respond to these particular issues.
And in terms of the increased collaboration that you've mentioned in the course of your evidence, you've also mentioned the impact that faith communities might have had around vaccines and the impact that faith communities could have when it comes to a distrust of certain people in the country at certain times. Are you able to help with how people in faith communities sought to mitigate those impacts during the pandemic?
Yeah, and it was a particular issue that there was a distrust. Partly people were probably more subjected to conspiracy theories, having had more time to be online, but there were issues that turning around of the COVID jab so swiftly caused people concern. But there is, I think, what we came to understand is the positive impact of faith was actually helping people grow in trust. So, as I said earlier, initial response from NHS officials were we don't need faith, because they were looking from a geographic response. We've got these centres. But what they weren't really understanding was they needed to have that trust response, and that anchor institutions, faith institutions, the relationships that faith have meant that they could walk people through and deal with some of the queries that people had around the COVID jab, which of course in the first thing was very successful, but we did have to bring into play often large churches, large mosques, which didn't just perform for those communities as well. They became points of safety and connection, and therefore there is that great opportunity. One of the positive impacts could be to see faith as an asset to be utilised.
And on that note, representatives in the roundtable, it may well have been you, suggest that the strengthening of communication between government and faith communities would reduce impact on faith communities in any future pandemic. There's also mention of the impact of functioning of informal public health actors in faith community activities. So are these things that chime with you and your experience?
Yeah, and I think one of the key phrases we say is that faith reaches the parts that nothing else can. So can get to people, people are more likely to connect with faith than they are with other official kind of connections, those kind of things. They're more likely to attend a mosque or a church or a temple than they are to register with a doctor. Those things will happen first. And therefore, those informal and trusted networks, the power of the person you know recommending something is still something, despite all the information's available, we still trust each other more than we do. So therefore, the ability that faith has to reach those people that are furthest from services are key. And one of the factors that we recognised very early on with the work that we were doing with the Health and Wellbeing Alliance is the prediction was that health inequalities would increase over COVID because the same people who had the worst outcomes would potentially be the most affected. And I think that's where we saw that faith had got a way of reaching those people and connecting and potentially getting the messages out that need to be got out to help people overcome COVID and the pandemic.
Thank you very much, Mr. Singleton. My lady, those are my questions.
Thank you very much, Mr. Jackson. Thank you, Mr. Singleton, for your help. An extraordinarily comprehensive review of so many different faiths and the problems that face the faith communities. Thank you very much indeed for your help. And I've said it's comprehensive, but if anything else occurs to you, don't worry, I will be taking very much into account witness statements and, of course, the roundtable events. And thank you for participating in that. Did you find it an interesting experience?
It was very interesting. Thank you, my lady.
Yeah, thank you very much indeed. Very well, I'll take a break now and I shall return at 5 to 3.
My lady, can you see and hear me?
Can, thank you.
My lady, the final witness for today is Francesca Hume. May she be sworn.
Repeat after me. I do solemnly,
I do solemnly
sincerely and truly
sincerely and truly
declare and affirm
that
the evidence I shall give
shall be the truth,
the whole truth,
and
nothing but the truth.
Lovely.
Thank you.
Will you give us your full name, please?
Yeah. My name is Francesca Hume.
Thank you very much. I know that you don't have it before you, but you have had a copy of your witness statement with our reference INQ 000659851. Can you please confirm that that witness statement has been provided jointly on behalf of a number of organisations making up the Migrants' Rights Consortium?
Yes.
Thank you, and that the facts stated within it are true to the best of all of your knowledge and belief?
Yes.
Thank you. I'd like to begin by setting out, please, the organisations who make up the Migrants' Rights Consortium. They are as follows: Doctors of the World UK, an independent humanitarian organisation which facilitates equitable access to medical services for marginalised and disadvantaged communities. The Joint Council for the Welfare of Immigrants, a charitable organisation dedicated to advancing justice, fairness and equality within immigration and asylum law. Kanlungan, which you are a member of, a charity consisting of several Filipino and Southeast and East Asian community organisations which work for the welfare and interests of migrants, refugees and communities from the Philippines and East and Southeast Asia living in the UK. MedAct, a collective of healthcare workers which focuses on investigating and analysing the social and environmental factors that have a detrimental impact on health. Project 17, a charitable organisation working to end destitution amongst migrant children. Just Right Scotland, a human rights legal charity, which during the pandemic provided legal advice and representation to refugees and migrants, victims of trafficking and exploitation, and survivors of domestic abuse in Scotland. Together with Migrant Children, a charity supporting children and young people and families where migration is a factor. United Voices of the World, a member-led anti-racist campaigning organisation supporting low-paid, working-class and predominantly those from Black, Asian and minority ethnic backgrounds, as well as migrant workers across the UK. And finally, the Independent Workers of Great Britain, which was established by Latin American cleaners for better pay, pensions and working conditions in London, and now includes couriers, porters, security officers and private hire drivers. Thank you. Terminology is important in your evidence, and I'd like to just set out with you a couple of phrases that we're going to use throughout the course of your evidence. The first is what's referred to as the hostile environment. That broadly refers to measures which identify and reduce the number of persons in the UK without leave to remain, many of which, the provisions of which were introduced by the Immigration Acts of 2014 and 2016. And those measures include restrictions and checks on the right to work, to rent accommodation, to have a bank account, to hold a driving licence, and indeed to access benefits or other free treatment from the NHS. Is that right?
That's correct.
Thank you. Migrant people who do not have leave to remain in the UK, including visa overstayers, those who have entered the UK without permission, and asylum seekers, do not have access to public funds. And is that often referred to as no recourse to public funds?
So no recourse to public funds is a specific condition that is attached to visas that are issued. So you could be a migrant on a skilled Tier 2 visa and have a no recourse to public funds condition attached to your permission to be in the UK. So essentially, migrants in general are barred from accessing mainstream benefits.
Yes.
And sometimes it's through NRPF or sometimes it's because they don't have valid leave to remain.
All right. Well, let's look at the list of migrants because there are a number of different types of migrants, aren't there? And there are subgroups within that description. And if we can look at page 13 and paragraph 55 of your witness statement, please. We can see that you here set out what you describe as a non-exhaustive list of the different subgroups to which Migrant Rights Consortium seeks to give a voice during the evidence to this inquiry, including asylum seekers whose applications remain outstanding, asylum seekers who have received a negative decision and who are appealing it, whose appeal rights have been exhausted and or who are seeking to submit a fresh claim, asylum seekers whose application has been refused facing removal but who could not be removed during the pandemic, and we'll come to look at why that might have been, destitute asylum seekers and unsuccessful asylum seekers reliant on Home Office accommodation, asylum seekers who have been granted refugee status or humanitarian protection, migrants with long-term or indefinite leave to remain, migrants with fixed-term or limited leave to remain, migrants on a dependency visa or subject to ongoing eligibility conditions, migrants subject to a no recourse to public funds condition, migrant victims of human trafficking or modern slavery, and undocumented migrants with no lawful immigration status who either entered the UK without permission, entered lawfully but overstayed their visa, or did not leave the UK after an application for leave to remain or their claim for asylum was refused. So it covers quite a spectrum of situations, from migrants who have successfully been through the system and who have been who have a leave to remain, all the way to those who whose applications have entirely been refused. And is it right then that taking a migrant from one end of the spectrum and one from the other, they may have had a very different experience during the pandemic?
Yes, it would have varied according to the type of immigration status that they had.
Yes.
To the type of accommodation that they were in, so whether they were in home office accommodation, in barracks, or if they were in the private rented sector. And also depending on whether they were healthcare workers, social care workers, because as we know, many migrants were at the front lines.
Yes. Going back to no recourse to public funds, is it right that at the end of 2020, so during the pandemic, there were an estimated 1.48 million people who held visas that come with a no recourse to public fund condition?
Yes.
Right. And is it also right that the government didn't suspend either hostile environment measures or the normal no recourse to public fund rules during the COVID pandemic, despite the fact that the government at various times and through various organisations were asked to do so?
That's correct.
All right. As of June 2021, is it right that the UK's population was made up of an estimated 9.6 million foreign-born people, which at that time was the equivalent of 14.5% of the population?
Yeah, that's correct.
Thank you. Which groups that we have just looked at in the list that you've provided at paragraph 55 did not have access to public funds then?
So it would have been the majority of people on that list. The only migrants who are not given a no recourse to public funds condition are people who are on a spouse or partner visa, or people who have indefinite leave to remain.
Right.
Migrant access to the benefit system is quite complicated.
Yes.
But broadly, migrants, including asylum seekers, do not have access to the mainstream system, but they might get specific support through specific schemes or specific routes.
All right. So it's not simply a question of looking through the list and saying they would, they wouldn't. It's more complicated than that.
Yes.
Yes. All right. Thank you very much. We can take that down. I'd like to turn to look at some of the characteristics of vulnerability specific to migrant communities, please. There are 5 areas which are set out within your witness statement, the first of which is mental and physical health. You tell us at paragraph 61 of your statement that some individuals within the asylum seeking and refugee community have experienced trauma arising from sexual, physical and psychological violence, torture, trafficking, exploitation and or loss in violent and distressing circumstances. Those circumstances are often having been what has led them to the UK. So according to research, your research, were asylum seekers 5 times more likely to have mental health needs than the general population going into the pandemic?
Yes, that's correct.
Right. Destitution and household overcrowding. You tell us at paragraph 64 that more than a quarter of destitute households in the UK as of 2022, so at the end of the pandemic, were headed by foreign-born individuals. Is that right?
Yes, and the risk of destitution for migrants is 35% higher than the average.
Thank you. And put in statistical terms as well, in the UK, migrants had a 22% higher risk of infection during the second wave of the pandemic compared to the UK-born population. Is that right?
Yes.
In addition to which, was poverty a driver that forced people to continue to undertake frontline work, including migrants, at increased exposure risk to avoid further financial hardship, according to your research?
Yes.
Thank you. And linked to that was the increased exposure to COVID-19 infection through being reliant, for example, on public transport.
Yes.
Was it reported to you that between December 2020 and February 2021, that those in the most deprived 40% of the population were 3 to 5 times more likely to use public transport and up to 8 times more likely to use taxis compared to those in the top 20%?
Yes.
Digital access linked to destitution. You tell us at paragraph 69 that during and after the pandemic, there was a move to digitalisation of primary care, with virtual appointments replacing face-to-face consultations. Did this cause particular problems for some migrants, and if so, why?
Yes, so it did cause problems because there is an issue with digital poverty in the migrant population, because there are higher rates of destitution and poverty within migrant communities. So then in terms of having the right data or having the right phones in order to access the digital services, that would be more difficult. But on the other hand, a lot of migrants who tend to be younger might be more tech savvy and might have a smartphone, and so might find it easier to access with in that regards. And it's also easier to translate information that's digital. So
do you mean translation to a different language?
To translate into a different language, yes.
Thank you. Is there an overlap with Black, Asian and minority ethnic communities and the experience that we know during the evidence that the inquiry has received and considered, the experience that they had during the pandemic?
Yes, definitely. And I believe about half of BAME people in the UK are foreign-born. So there would be a huge overlap in experiences.
Thank you. And you tell us at paragraph 70 of your statement that from the 1st of September 2020 to the 22nd of May 2021, Asian communities experienced up to double the rate of infection in relation to COVID compared to those from white British backgrounds.
Yeah.
Thank you. Turning to frontline and essential work and the frontline workforce, at paragraph 73, you say that in 2020 and 2021, it is estimated that migrants comprised 18% of the employed workforce in the UK, and that migrants were particularly overrepresented in the hospitality sector, comprising 28% of workers, the transport and storage sector, comprising 26% of workers, the information and communications sector, comprising 25% of workers, and the health and social work sector, comprising 21% of workers. Is that right?
Yes.
Yeah. East and Southeast Asian migrants, you say, accounted for 23% of the health and social workforce in 2020, and were only exceeded by sub-Saharan African migrants, who made up 27% of health and social workers. Is that right?
Yes.
Right. At paragraph 76, you say that Britain has one of the highest levels of foreign-born nurses in Europe, with an estimated 40,000 Filipino staff employed in the NHS in 2020, for example.
Yes.
And you say that there was a devastatingly disproportionate number of COVID-19 deaths among Filipino health and care workers in the UK. For example, you say that in May 2020, 22% of COVID deaths amongst NHS nurses were Filipino.
Yes, and that's especially disproportionate when you consider that only 3.8% of the nursing workforce were Filipino, so that is a really big disproportionate impact. And in general, there was a disproportionate impact on migrant healthcare workers. For example, 83% of ethnic minority healthcare worker deaths were individuals who had been born outside of the UK, and that was in April 2020. So with the Filipino statistic, I think it shows an example of that extreme level of disproportionate risk, but was symptomatic of a broader issue of migrants being consistently pushed to the most dangerous and the most frontline roles during the pandemic.
Thank you. Moving to look at mortality rates of marginalised communities due to COVID-19 transmission. You say at paragraph 159 that from the outset of the pandemic, migrants faced a significantly higher risk of infection and death compared to the general population. Is that right?
Yes.
The obstacles faced by migrant communities in accessing healthcare functioned, you say, as a contributory factor to this disproportionate impact, leading to increasing health inequality and worse outcomes for migrants.
Yes, and it's not just the difficulty in accessing healthcare, which obviously that is a huge factor, and we know that because of data sharing between the NHS, the Department of Health and the Home Office, there is a lot of fear ingrained in the migrant community about accessing the NHS, and I supported people directly who were too scared to go to the doctor when they had suspected COVID, were even too scared to order a test in their own name. I would have to order it in my name instead to their address.
Why was that?
Because they were too scared that, that their name and address would then be shared with the NHS, who then would be able to share it with the Home Office, and that the Home Office might undertake immigration enforcement to remove them. But the other reason why a lot of migrants died as a result of COVID was because, not being able to access public funds, not having that social safety net that other people had, meant that people couldn't afford to take sick leave. And yes, in some cases they were eligible for statutory sick pay, but statutory sick pay only kicks in after 3 days. And then after that, you're only paid £19.17 a day, which really isn't enough to survive. And we know that a lot of people that we supported, across the Migrants' Rights Consortium, simply couldn't afford to do that because they needed to be paid every day. And
Sorry, just to bring you back to impact. So the impact of that 3-day delay meant that people just didn't have access to funds in order to live.
Yes,
Right.
and so that was the case for Emmanuel Gomez, who was a member of UVW, who are a member of the Migrants' Rights Consortium. He was an agency cleaner with the OCS agency, and he was working at the Ministry of Justice since 2018. In April 2020, he got ill with suspected COVID-19, but he couldn't afford to go on sick leave because of the reasons that I've outlined. So instead, he kept on working, and it was reported by his colleagues that he hadn't eaten in the 5 days before he eventually died after a shift at the Ministry of Justice.
Can I take you back to the sharing of data, please, and reflect upon evidence that was given to the inquiry yesterday?
Yeah.
The inquiry heard that some organisations were campaigning to the government for there to be a firewall set between the police and health agencies. And although that didn't eventually come to fruition and that wasn't installed, is that something which you would promote in order to encourage the provision of information by those who were sick during the pandemic in circumstances where they could be confident that that data wouldn't be shared with, for instance, immigration enforcement agencies?
Yes.
Thank you. Moving to access to healthcare then, please. Do you say that it was foreseeable from the outset of the pandemic that some of the measures put in place in response would have a disproportionate impact on and be devastating for some marginalised sections of society?
Yes.
And do you say that going forwards it's important for governments to consider the impact of measures such as those that were input during the course of this pandemic on those who are most marginalised in society?
Yes.
Right. You say at paragraph 78 that pursuant to charging regulations introduced in 2015, overseas visitors, including migrants, must pay for relevant NHS services. Those provisions were lifted, were they not, during the course of the pandemic?
No. So basically, COVID-19 was added to a list of exemptions.
Exemptions, yes.
Yes, for, I believe it's communicable diseases.
Yes.
And so it meant that even if you hadn't paid your international health surcharge, or if you were a visitor and, yes, were not usually supposed to be accessing the NHS, then any primary care that you needed from a COVID infection would have been covered. However...
Well, just before you go on to the however, isn't that then an example of the government considering the effect of COVID on the marginalised in society?
Yes, I suppose it could be an example of that, but they didn't clearly communicate it. It was down to community organisations like Ganlungen, medical organisations like Doctors of the World, MedAct, to make that communication really clear. And the problem as well was that for any secondary healthcare needs that could arise from COVID, for example, a long-term disability or long COVID, that would not have been part of the exemption. I think also we really can't underestimate the amount of damage that was done in terms of trust from that pre-existing data sharing. So even if people knew that they could, go to the doctor or go to the hospital even because they had COVID, and later on, once the vaccines became accessible, that they didn't need to show proof of residence or proof that they'd paid the international health surcharge in order to access the vaccine. People were still scared. They were still scared that somewhere down the line that data would be shared and that they would be found out. And so that's why organisations like Ganlungen, like Doctors of the World, stepped in, and we had to actually organise vaccination clinics to make sure that people could get access to the vaccine.
Thank you. Well, we're going to look at some of the effects of the restriction in access to healthcare now. I'm going to ask that over the course of the rest of your evidence, we look at 3 sections of the Justice Roundtable summary report. The first is at pages 43 and 44, please. Thank you very much. So this is the report from the Justice Roundtable, where the Immigration Law Practitioners Association noted that government guidance about COVID-19 and its impact on the immigration system was not provided in formats that migrants could understand, with literacy skills being a significant barrier. This created significant information gaps concerning COVID-19 measures, healthcare access, as we've been discussing, policy changes and vaccines. Consequently, many migrants were unaware of the healthcare resources available to them during the pandemic, so did not access them. The NHS exempted anyone living in the UK without permission from charges for COVID-19 healthcare, including testing for COVID-19, treatment for COVID-19 and vaccinations. Healthcare staff were also instructed not to conduct the usual immigration checks when providing COVID-19 healthcare services. However, representatives felt that migrants and asylum seekers remained fearful about accessing services due to their mistrust of authorities. And that's what you've just been explaining, Ms. Humey. This was driven by fears that the immigration status might be reported to the Home Office. The Immigration Law Practitioners Association also suggested that many migrants were not registered with GPs and did not have an NHS number and therefore could not access COVID-19 healthcare. And there's then an example from the Joint Council for the Welfare of Immigrants. Migrants who were discouraged from accessing healthcare for a long time were cynical at the prospects of accessing it suddenly during the COVID-19 pandemic. And the representative for Bail for Immigration Detainees also described a lack of clarity surrounding who was eligible to access the COVID-19 vaccine, which created uncertainty for migrant detainees about whether they could get a vaccine and protect themselves from COVID-19. Then goes on to discuss people without recourse to public funds. Representatives highlighted the detrimental impact of the pandemic on migrants living without recourse to public funds, NRPF, exacerbated by not having access to usual support networks such as friends and family, as well as services like libraries. Project 17 explained that migrants with no recourse to public funds were often employed in minimum wage jobs or the informal economy, jobs that are not taxed, monitored or regulated by the government, and that they often lived in overcrowded conditions. Despite government guidance, many felt they had no choice but to continue to work through the pandemic, risking COVID-19 infection and transmission within their households. Project 17 also noted an increase in domestic abuse and homelessness among migrants with no recourse to public funds during the pandemic. And finally, there's a quote from Project 17. Because they had no access to public funds, they faced the real impact of starvation and not being able to feed their kids. So does that encompass really all the aspects of difficulties that you've explained so far in your evidence affecting those migrants, particularly who had no recourse to public funds?
Yes.
Thank you. We can take that down, please. Access to primary care services, including GP services, and the impact of digitalisation. We've touched upon this. Were there barriers to GP registration for migrants going into the pandemic, and did those remain during the pandemic?
Yes. Doctors of the World research shows that in 2018, for example, 1 in 5 registrations were refused. And so during the pandemic, those kinds of patterns of refusal were maintained, with the added difficulty that you couldn't go in person to advocate to be registered. It was all done digitally or over the phone.
Thank you. Was there an impact of housing instability and deregistration of continuing care?
Yes, there was. And I think it was especially difficult for people who were in home office accommodation,
yes,
where the essentially the problem was that it varied according to the hotel. And if you had a manager at a hotel who was willing to support the registration of the people living in the hotel with the local GP surgery, then that would be great and that would be facilitated. However, most of the time, these hotel managers were not trained to be healthcare providers or to be sort of advising people on their rights to access healthcare. So
what was the impact of that?
So the impact was that people were not able to register with a GP, or if they did register in one hotel, after they were dispersed, they would end up in a completely different area, and then that care would be disrupted, and so it would make it very difficult for them to continue to be seen, and then in terms of vaccination, for them to get that vaccination.
Was there, in addition, a disruption to non-essential appointments, including a reduction in drop-in facilities? And how did that impact upon migrants?
So that also had quite a negative impact on migrants, again, for similar reasons around like instability with housing or people being dispersed in different accommodation.
Thank you. Moving to the impact on mental health and well-being and access to mental health services, please. At paragraph 141, you report that a survey conducted in April of 2021 found that ethnic minority and migrant populations experienced disproportionately higher levels of depression and anxiety during the pandemic compared to white, British and UK-born populations, with 15% of migrants reporting symptoms consistent with depression. Is that right?
Yes, that's right. And actually, Kenlingen conducted its own research in 2020 and 2021 and found that 50% of our service users said that their mental health had been greatly affected. And I think it's important to note on the mental health that the poor mental health is exacerbated by a difficult migration journey, whether that is as an asylum seeker or even as a migrant. It's very difficult to come to the UK. And so then the restrictions that were placed during the pandemic, which limited social contact, which limited also people's ability to see family from back home, to go visit them, and to make sure that they were okay, that really made things much worse and much difficult. And on top of that, because of this difficulty with accessing healthcare in general, migrants also found it difficult to access mental health support services
yes,
that were culturally appropriate, that were maybe in the language that they preferred. So as a result, for example, Kenlingen actually set up 3 separate mental health programs supporting specific communities within our broader service user base. So we did one program for elderly people, one for young mums, and then one for healthcare workers.
Thank you. The inquiry has heard about access to justice insofar as it relates to other vulnerable groups and victim survivors of domestic abuse, and we'll also hear later this week from other organisations such as the Howard League for Penal Reform, the Prison Reform Trust and the Legal Aid Practitioners Group. Focusing specifically on those within the immigration and asylum system and the challenges that they faced, is it the case that the pandemic led to considerable delays and backlogs in the immigration and asylum system?
Yes, there were huge delays in terms of decision making, and there had already been a backlog. I mean, the asylum backlog is quite infamous at this point. But what also added to the difficulty in access to justice was that solicitors, barristers, other people working in community organisations were having to take instructions over the phone, over video, if people didn't have stable internet connection, for example, if they were in asylum accommodation and didn't necessarily have access to Wi-Fi or didn't have a smartphone, then that made those meetings really, really difficult. And I think a lot of the work that we do in the migration sector is being able to talk with people in person and really trying to assess how they're doing so that we can help, really help people. And so doing that on screen made it much more difficult. And
Yes.
I also heard from, for example, Together with Migrant Children, one of the core participants,
Yes.
that, it did affect the the quality in legal support, because if you're meeting with, for example, the council, the housing team, safeguarding team, the immigration solicitor and the person advocating for the family, if you're not all meeting in person and you're not confronted to that person who needs accommodation right now, it's much easier to refuse. It's much easier to miss signs of additional vulnerability or additional safeguarding needs. So it really had a very detrimental impact on people. And there were some cases, like with a JCWI client who basically didn't understand that because of the lockdown, the JCWI office would be closed. She missed that appointment and she misunderstood and basically thought that her application had been filed, but actually it hadn't. And thanks to a mental health support worker that she had, that support worker was able to contact JCWI and notify them, like, hey, she's under kind of the wrong impression that this application has been filed. Has it been filed? Can you please, confirm what the next steps are? And they were able to support that person.
Right, and that was something which had been created by a situation where there wasn't face-to-face contact. Is that what you're saying?
Yes. And also around a general lack of clarity around the temporary concession that had been granted to migrants. So the Home Office put out a kind of statement saying that if you were in the UK on a temporary visa or if your leave to remain had expired, basically there was a concession so that if you couldn't travel, couldn't leave the country because the border was closed because of the pandemic, then you wouldn't get into trouble for that, basically.
Right.
But that directive wasn't communicated very well, and it was quite unclear how long that concession would remain in place.
Right, and the impact of unclear messaging such as that is that people didn't understand and thought, in that example that you've just given, that an application had been filed when it hadn't.
Yes.
Right. Returning to the Justice Roundtable, please, and having a look at what was said during that procedure about delays in case progression at page 35 and onto page 36. In fact, I think we only need to look at the first two paragraphs, so it's just these two and then over onto the next page. The Justice Roundtable was told that the pandemic negatively impacted the quality of service provided to migrants navigating the immigration process, according to representatives. The Immigration Law Practitioners Association explained that some immigration lawyers were furloughed during the pandemic, leaving migrants without legal support for their immigration cases. There were difficulties in accessing immigration case documents during the pandemic, which, according to representatives, delayed the progression of cases and was distressing for migrants. The Immigration Law Practitioners Association expressed that there was a significant lack of clarity regarding whether and when immigration lawyers were considered key workers, other than when they were attending or working on court and tribunal hearings. And they highlighted an example of a practitioner working on an application to the Home Office and it being unclear if the practitioner was a key worker and was able to go and collect physical documents from the office to progress these types of cases. The requirement to work from home impacted the ability to carry out essential tasks such as compiling documents or collecting evidence. And the representative for the Joint Council for the Welfare of Immigrants highlighted delays in processing subject access requests, impacting on the ability to collate relevant material. So Thank you very much. We can take that down. So there was a difficulty in accessing legal advice and legal representation because of the number of available lawyers. There was a difficulty in whether or not those lawyers were properly assessed as key workers, and then there was the impact of that situation on the migrants themselves.
Yes.
Thank you. Access to benefits, food and other services. And just touching upon this briefly, please, at paragraph 197, you say that additionally, school closures during the COVID-19 pandemic meant that children were at home for extended periods, removing a key source of regular meals for many migrant families. Is that right?
Yes.
And was that the position at all times of lockdown throughout the pandemic?
Yes, I believe so.
When schools were closed, yes. Housing security and conditions, we've touched upon some of these already, but looking for a moment at rent arrears, you tell us at paragraph 212 that the economic fallout of the pandemic led to widespread job losses, reductions in income, hitting migrant workers particularly hard as they were more likely to have precarious and informal jobs. And with little or no savings and no access to public funds, even a short disruption in earnings would translate into rent arrears, that some households were forced to prioritise basic survival needs, and for those supporting family members abroad, the pressure was even greater.
Yes. And there's a JCWI study that found that the impact of COVID-19 was most severe on workers with no recourse to public funds, and 14% reported being unable to pay their mortgage or rent on time compared to 2% of the rest of the population. I think another kind of element that is really important in housing security and conditions for migrants is for migrant survivor victims of domestic abuse,
yes,
which we heard from yesterday, but also in particular for domestic workers who lived in with their employers.
Yes.
At Glenlungan, we had a lot of members who were live-in domestic workers for private employers,
yeah,
for families, and because they lived in with them, if they lost their job or sometimes if they got COVID-19, then they would lose their accommodation. And we had some cases of people being made street homeless by their employers because they had gotten COVID-19 or because they were locking down and they didn't want the worker to be part of the household. Or similarly for a care worker that we spoke to and who has given evidence, written evidence in a previous module. She was working for a care home. She worked for a week. She got COVID in the process, and then the care home shut down because too many of the patients had died. And she was made street homeless, and she spent the night on a bench because she didn't know who to turn to and couldn't get any support. And then she got in touch with Glenlungan after that.
Thank you. At paragraph 216, you explained that as growing numbers of migrants struggle to keep up with rent payments during the pandemic, the government's temporary stay on evictions was a critical intervention. But you say it didn't reach all those that were at risk.
Yes. So, for example, for people who were living in with their employers, there wouldn't have been the same application.
Thank you. The Everyone In scheme, about which the inquiry has heard, provided considerable benefits for those who were accommodated, including the opportunity to support people recently made homeless back into housing swiftly and to protect them from the challenges that people experiencing homelessness long-term often face. But you go on to say, again, that there was an uneven application in terms of undocumented migrants. Is that right?
Yes, well, the government didn't provide additional resources in order for the local authorities to apply this Everyone In directive or scheme. And so it really depended on local authority funding. It wasn't clear how it applied to migrants. Some migrants were still denied housing as a result. And for example, at Glenlungan, we weren't even aware of the Everyone In scheme because it didn't even make it to migrant communities in terms of that communication. So you really have to question how effective the messaging was. And so it meant that a lot of migrants were left out, basically.
Thank you. Access to accommodation support. You tell us at paragraph 243 that local authorities faced major challenges supporting people with no recourse to public funds during the pandemic. And in Scotland, migrants faced similar problems. Just Citizens urged the Scottish Government to encourage consistency across local authorities in their response to housing migrants. Does that indicate that there was an uneven application across different local authorities of accommodation support?
Yes, and I think that comes from the fact that typically a migrant household would only have access to local authority housing if their need fell under Section 17 of the Children's Rights Act, in which there is a child whose needs can't be met by the family directly. So the state, in this case the local authority, has a legal obligation to support,
yes,
but not every migrant household is going to have children.
In terms of those who were accommodated in hotels during the pandemic, the Housing and Homelessness Roundtable heard about the No Accommodation Network's experience, who said that those in hotels gained better access to immigration advice, as some hotels provided immigration support services on site. So that that enabled them to ask questions about the migration system, understand their rights more clearly, and in some cases regularise their immigration status. And they said that the access to immigration advice in a lot of hotels was good, that people had access and time to engage with it, and that they saw some really good outcomes in terms of people who could regularise their status once they knew what their rights were. But that wasn't the case for everybody.
No, that wasn't. For example, Project 17, together with migrant children in particular, reported really difficult access for people in hotel accommodation to appropriate legal advisors and also healthcare, as we've noted. And a huge issue that they highlighted as well was that sometimes their clients would get dispersed and they literally wouldn't know where they would have gone. And sometimes they wouldn't have been able to keep their phone with them, or maybe they just lost touch with them. So that made it really difficult to keep that provision consistent.
Yes. I want to turn now, please, to look at impact on working conditions, and in particular, key workers, who you may know, Professor Marmot, who gave evidence last week, described the frontline key workers as the heroes of the pandemic. Could we have a look, please, at the Public Health England report, Understanding the Impact of COVID-19 on Black, Asian and minority ethnic groups? Thank you very much. And can we go, please, to page 35? Noting that this report was made in June of 2020, and look at risk assessments. The issue of occupational risk assessments came up repeatedly in engagement sessions involving professionals as well as community representatives. It was felt that evidence-based tools that could help employers to understand risk and to identify employees who may be at increased risk of acquiring or transmitting infection would be helpful. Many participants called for an evidence-informed, standardised risk assessment tools. However, it was also recognised that support and guidance must accompany the use of these tools to ensure that workers do not feel discriminated against and ensure that they feel safe to identify risks and issues without fear of losing their job. Other factors indicating exposure risk. Stakeholders highlighted other factors that may be contributing to the increased risk of exposure, including the important role of culture, including places of worship, multi-generational households, and variation in social interactions. Some Black and Asian minority ethnic groups have been segregated in overcrowded urban housing centres and workplaces, the conditions of which can make physical distancing and self-isolation infection difficult, leading to increasing risks for the spread of COVID-19. Stakeholders were also concerned that British and Asian minority ethnic groups exposed in crowded places and becoming seriously ill might be further infected from multiple sources, and a comparatively large infectious dose of COVID-19, further driving onward transmission and influencing the severity of their disease. These complicated social determinants of health might explain the increased risk of infection, but not necessarily worse outcomes, and all these factors needed deeper examination before we can draw valid conclusions. Stakeholders felt that once infected, many of the pre-existing health conditions that increase the risk of having serious infection, such as having underlying conditions like diabetes and obesity, are more common in British and Asian minority ethnic groups, and many of these conditions are both socially, economically patterned. For many British, Asian and minority ethnic communities, especially in economically deprived areas, there is a higher risk of having high incidence of chronic diseases and multiple long-term conditions, and these conditions occurring at younger ages. So is it your experience and those of the other organisations that make up the Migrants' Rights Consortium that many of your members fell within the people who were being described here?
Yes, but can I check that you meant Black, Asian and minority ethnic and not British, Asian
I'm sorry, did I say
ethnic?
British? I meant Black.
Okay.
Black, Asian and minority ethnic. Please accept my apology for that. Yes. But is it your evidence, Ms Humey, that those who come within the Migrants' Rights Consortium umbrella fall within the difficulties that we see described here?
Yes, and in fact, a lot of migrants who are BAME will have even worse conditions than the ones described here because of the kind of compounding effects of immigration control, visa conditions, and those kinds of things. So, for example, around the fear of losing a job when raising risks, that was something that Filipino nurses reported to us many times. They were really concerned that they would be labelled as a troublemaker, that the managers of at work wouldn't want to assign shifts to them anymore, and they were worried that if they lost their job, then that would mean that they would have to find a new sponsor for their visa, because if you are on a work visa, you only have 60 days to find a new sponsor, which would have been really difficult and incredibly stressful during the pandemic. So a lot of them felt really that they couldn't push back, even though they felt that they weren't being given equal access to PPE, that they were being overly exposed to the pandemic. Some of them were told, you're Filipino, you're hardworking, you can take it. You can go on the COVID ward and you can be exposed without adequate PPE because you're a hard worker. And so there's a complete manipulation of migrant workers and really taking advantage of their vulnerability and exposing them to COVID.
Well, I was going to say, what was the impact of what you describe on those workers?
Yeah. Well, the impact was the 22% death rate amongst NHS nurses being Filipino, despite Filipinos being only 3.8% of the nursing workforce. We really saw it repeatedly, and it was really like people were messaging us, contacting us constantly about this at the time.
Before turning to lessons learned and summarising what you say in your report, I just want to touch upon financial insecurity. And could we have a look, please, at the report from Doctors of the World UK, which is entitled A Rapid Needs Assessment of Excluded People in England During the 2020 COVID-19 Pandemic, and it's dated May of 2020. Thank you. And can we go to paragraph 10.4.1? Relating to job losses and destitution. The COVID-19 pandemic comes at a time when many in the UK are already living in poverty or destitution during COVID-19 due to pressures on businesses and temporary closure of many workplaces. Many have lost their jobs. Many examples were reported during interviews. And then a number of people in the UK are formally employed on temporary visas that do not permit the bearer to any access to public funds, such as housing or employment benefits. This means that some people have lost their jobs during COVID-19 but have no access to public funds or savings and have become newly destitute, as we have discussed this afternoon. These temporary residents who may have ordinarily returned to their country of origin after a job loss are currently unable to do so due to the international travel restrictions, which you've also set out, Ms. Humey. Some people, such as sex workers or those with irregular immigration status, make an income through informal work in order to survive. People working informally who have lost their jobs or can no longer work are not eligible for the benefits, protections and entitlements offered to others during the pandemic. Many of these people, previously managing to support themselves, have become newly destitute. Now the highest number of people we see, they are not our usual service users, but people who have now lost employment, illegal employment. They have lost their means of support and have become homeless. They have been washed out. And another group that has been heavily impacted by job losses are the Gypsy, Roma and traveller community. This is because many are self-employed or the work undertaken is informal or seasonal. The manager of Southwood Travellers Action Group, explained how this loss of employment is not only concerning for the immediate household, but for extended families and communities. What I'm really worried about is that the people who work, they very much share their income with the poorer people on the sites. So they have been there almost as a safety net on the site. And I'm really worried they won't be able to support the community as much as they used to. So does that really encompass all of the difficulties in terms of financial insecurity and a lack of access to funds during the course of the pandemic that Migrants' Rights Consortium members and those that they represent were facing?
Yes, and I think it also, the kind of the implication of this as well is people staying in exploitative or insecure work. So, for example, we represent a lot of gig workers or couriers who were exposed to disproportionate risk to COVID-19 through their delivery work and weren't considered necessarily frontline workers, so weren't being given access to the same level of PPE as others. One medical courier described going into a room in a hospital to pick up COVID-19 specimens for testing and not even being given a face mask or gloves to handle the specimens. And that was because he was working for an agency that just simply didn't prioritize him. And a lot of these gig workers, couriers, drivers faced really, really difficult working conditions. Some workers weren't even allowed to use the restrooms when they went into restaurants to pick up food that they were then going to take to the person who'd ordered it. And some women drivers and couriers reported having to change their sanitary pads in the street because restaurant owners wouldn't allow them to use the toilets because of COVID restrictions.
Thank you. Turning then to lessons learned and recommendations. You begin by saying that there needs to be a recognition of the disproportionate impact of the pandemic on the health, well-being and mortality of migrant communities, that in anticipating the next public health emergency, it's critically important to identify the needs of marginalised and migrant communities and to take robust and expeditious remedial steps, that there were gaps in public health messaging and an over-reliance on community organisations to meet basic needs to overcome barriers to accessing essential services and daily necessities, such as food. There needs to be a conscious minimising of the impact on migrant communities and a properly funded, language-specific and accessible public messaging campaign on the next occasion, which needs to be implemented to ensure that public health messaging reaches migrant communities. Is that right?
Yes. Ultimately, what we found during the pandemic is that immigration enforcement was prioritised over public health. And Kemi Badenoch herself admitted that in Module 4 of this inquiry. She said that it was right for the government to have prioritised immigration enforcement over public health.
I'm sorry, we're not going into decision-making. I'm really sorry, Ms. Huey, but I think you're now stretching a point. A, you're going political, and B, stretching decision-making. Can we keep to the question that Ms. Blackwell asked you, please?
Are there any other issues that you want to raise in terms of impact and what needs to happen next time, other than those that I've already set out?
I think all of the evidence that we've shown is how damaging the no recourse to public funds condition is and how devastating it is for people to be locked out of a mainstream benefit system.
Right.
So I would really urge for the government to reconsider the no recourse to public funds condition.
That concludes my questioning. We don't have any questions from any other call participants, my lady, and indeed that concludes the business of today.
Thank you very much. Ms. Huey, thank you very much for your help, both in this module and the other one. I'm sorry I had to intervene, but I think you understand that I've got a difficult tightrope to walk here, and I can't get too political. But thank you very much indeed to you and your colleagues in the other organisations in the consortium that you've represented today. I'm very grateful to you.
Thank you.
In which case, I shall return for 10 o'clock tomorrow morning.
Thank you, my lady.